Hey everybody, here's another great question that came to Ask Winnie King, MD. The question is, the older a person gets, how often should they get checkups? Well, we naturally think that as you get older, your risk for having serious medical problems starts to go up. We know that, your risk for cancer and heart disease, strokes, all of that goes up. But you know what? People at very young ages can have all of those problems too. So yes, getting older, it's really important to have a relationship with a doctor, especially a primary care doctor who can do an overall assessment, and that should be a yearly event. But even when you're younger, you should have a physician that you can check with and make sure that you're okay. I worry a lot about things like colon cancer and lung cancer and even skin cancer in younger people that can go undetected because people assume that because they're young, they can't have a problem. Breast cancer, prostate cancer, all of these things can occur at a much younger age than I think people realize. And I've been so surprised to have patients come to my practice who've never had a mammogram and they're in their 40s or in their 50s. That's crazy. You can't do that. You can, but it's very dangerous. And you run the risk of having a malignancy, a cancer, growing in your body silently without any symptoms until it's so large and so evident that it has spread to other structures, and now your life is at risk. So sure, when you're older, regular yearly exams are important, but it's also important to get started at an early age of just basic general self-maintenance. You'll feel better when you go to the doctor and you get your blood pressure checked, you get your cholesterol panel done, your blood sugar checked. If you're a woman, you get a pap smear and a pelvic exam and you get a mammogram. That way you know that you're okay, rather than hoping for the best. And if you are a sun worshiper, checking your skin, having somebody check it, looking for any abnormalities in the skin. Malignant melanoma is a terrible cancer, and I've lost some friends to that. And to look at it, it just looked like a little multicolored blip on the skin. But underneath, it had metastasized and spread all throughout their body. And to look at the skin lesion, you would never have guessed it. And they ended up passing away from that. So it's really important to just take care of yourself. Have a relationship with a physician ongoing all throughout your life. Doctors don't want to see their patients for the first time when they turn 65. We want to see you when you're in your 30s, and we want to follow you all throughout your life, just so that we can detect things when they show up, and also advise you so that you can adjust yourself, choose lifestyles that are going to reduce your risk. If you are a smoker, we know what that does to your arteries. We know what that does to your lungs, and we can help you to stop smoking and give your lungs a chance to repair themselves and reduce your risk of cancer. So it's always important to see a doctor. The older you get, certainly you should be seeing a doctor every year. And most people do, because as you get older, you tend to have health problems, and so you have a relationship with a doctor. And for younger women, even if you're going to see your gynecologist every year for your annual well woman exam, that would be a great way to start. And then they will do vital signs on you. You can ask for blood work and then go from there. But it's important to always have a relationship with a healthcare provider so that we can not only treat things that show up, but we can help you not have those problems in the first place. Great question. Keep them coming. This was a good one.